Hi everyone, this is Dr. Arun Kannan from Apollo Hospital, Chennai. In this video, I will talk to you about a problem that is called as kneecap dislocation. This is not uncommon amongst youngsters who sometimes tend to dislocate their kneecap. So, to have an idea of what the kneecap is a small bone in front of your knee joint, and it goes like this. So you can feel it. It is just under the skin. It is not the main bone of the knee joint. The main bones are the thigh bone and the shin bone, and this kneecap is right in front of the main knee joint. However, it is very important for getting good knee bending and straightening, and it goes along the femur bone or the thigh bone as the knee goes from straight position to the bent position. You can see that here on the first picture on top. If you see, the kneecap lies in a groove, or it is like a shallow groove on the thigh bone. This is how it rests, and when the knee bends and straightens, it has to remain in this groove. However, if there is an injury, sometimes the kneecap can get dislocated. It can come out of this groove, and this is what we call as a patellar dislocation or a kneecap dislocation. Here you can see on the picture on the right, the kneecap is in position. After the injury, it has come out on the outer side, or we call it as the lateral side, and this is now in a dislocated position. So this can happen because of injuries. It may not be a very major injury like a fracture, but it can be twisting injuries, sports injuries, or even very minor injuries can lead on to this kind of kneecap dislocation. So when the kneecap dislocates, it moves generally to the outer side, or we call the lateral side. The kneecap moves away and comes out of the groove. This is what we call as a kneecap dislocation. So what happens when the kneecap dislocates? The kneecap is held in the groove by generally what we call as ligaments. There are ligaments on either side that hold the knee in the central position. When the kneecap comes out or dislocates to one side, generally the ligaments get torn. We call this main ligament as MPFL or medial patellofemoral ligament, and this becomes torn when the kneecap dislocates. So if you have had a first time dislocation, the knee ligament has generally torn, the MPFL ligament has torn, the kneecap is lying outside. The kneecap can generally be brought back to position, but for the ligament to heal, we'll have to give the knee some period of rest. Generally involves about 4 to 6 weeks of rest. The knee has to be kept straight in something we called a knee immobilizer or a knee brace. We apply a long knee brace like this, keep the knee straight so that the ligament is rested, there is no strain on the ligament, and it generally heals. In over 80 to 90% of people, the knee ligament will heal if it is given adequate rest. However, in a certain number of people, the ligament may not heal, or if the ligament is not rested properly, it may not heal. So in these people, what happens is we have recurrent dislocation of the kneecap, or the kneecap comes out again and again with certain activities. Generally, it is not an injury, first time injury, then followed by recurrent dislocation with minor disturbances in balance. So we call this as recurrent dislocation of kneecap. When this happens, it means that the ligament has not healed and it is not keeping the kneecap in stable position. So if we find this out later after 3 or 4 dislocations, at that time putting a belt and expecting it to become alright generally does not work, because the ligament has been damaged and it is stretched out. So in these cases, what we generally do is something called a medial patellofemoral ligament reconstruction. We reconstruct this ligament using a tendon graft. We usually take a small portion of the hamstring tendon and attach it to the kneecap and to the thigh bone and fix it with specialized bio screws. With this, the kneecap ligament is reconstructed or replaced. So once this happens, once this is done, then the new ligament functions in place of the old ligament and keeps the kneecap in balance. This surgery has an excellent success rate. More than 95% of people return back to sports or whatever activities they were doing without much discomfort. So in a nutshell, kneecap is a small bone in front of your knee. It has to travel or move along a shallow groove on the lower portion of the thigh bone, and when the kneecap sometimes dislocates because of injury, it can tear the ligament. So when the ligament is torn, the balance is gone. So initially, after the first injury, if the ligament is rested with the knee brace, it can heal back. However, in certain individuals, it tends to do a recurrent dislocation or dislocates again and again. And in these patients, we require surgery in the form of ligament reconstruction using a hamstring tendon. And this is generally quite successful. Thank you.